Ever wonder why you feel irritable, anxious, or just plain exhausted after a poor night's sleep? Science shows that sleep isn't just for resting, it's your brain's ultimate recharge. During deep sleep, your mind works behind the scenes, processing emotions, building resilience, and restoring balance. But miss out on quality sleep, and your mental health pays the price. From heightened stress to worsened anxiety, sleep is the hidden key to staying mentally strong. Want to boost your mood, focus, and resilience? It all starts with getting the right amount of rest. Stick around to find out why sleep is truly essential for your mental well-being. Power of sleep. Why your mental health depends on it. Sleep is essential for more than just physical rest. It's a cornerstone of mental health. Beyond the basics, sleep plays a critical role in emotional stability, cognitive performance, and resilience. This video explores the crucial connection between sleep and mental health, helping to shed light on why quality sleep is essential for a well-balanced mind. Chapter 1. The Science of Sleep and Mental Health. Sleep isn't a passive process, it's an active time for the brain to repair, reset, and prepare for the challenges of the next day. During sleep, the brain cycles through two main stages, non-REM and REM. Each stage serves different purposes that directly affect mental health. In non-REM sleep, the brain is busy with housekeeping functions, repairing cells, restoring energy, and strengthening the immune system. Studies have shown that during sleep, important brain chemicals like serotonin, which stabilize mood, are restored. This reset enables us to approach each day with a fresh perspective, enhancing emotional regulation and stress management. Chapter 2. Mental health risks of poor sleep. Poor sleep can severely impact mental health. Chronic sleep deprivation disrupts the brain's ability to process emotions and regulate mood, leading to increased irritability, mood swings, and even aggression. When someone doesn't get enough quality sleep, they are more susceptible to developing symptoms of anxiety and depression. Lack of sleep also raises cortisol levels, the body's stress hormone. With consistently high cortisol levels, people experience heightened stress, which can lead to a vicious cycle of worsening sleep and further mental health challenges. Poor sleep affects cognitive functions like concentration, memory, and decision-making. When sleep deprived, the brain struggles to process information, leading to mental fatigue, reduced problem-solving abilities, and a sense of being overwhelmed. This can make everyday challenges seem even harder to handle, which, over time, can erode mental resilience and increase stress. Chapter 3. Sleep and Emotional Resilience. Getting good sleep is not just about feeling rested, it's about building emotional resilience. With adequate sleep, the brain is better equipped to regulate the amygdala, which processes emotions. This regulation allows us to react more calmly to stressors and navigate difficult situations without becoming overwhelmed. Sleep helps us stay patient, positive, and resilient. The brain uses sleep to categorize and store memories, which helps us gain perspective and learn from experiences. It's an essential time for the brain to sort through emotional events, allowing us to be better equipped to face new challenges each day. Sleep's positive effects on mood and emotional regulation are especially valuable for individuals managing anxiety, depression, or other mental health conditions where emotional balance is crucial. Before we go ahead, don't forget to like this video, subscribe to our channel, and hit the bell icon to stay updated. Chapter 4. Tips for Better Sleep Hygiene. Here are practical tips to help improve sleep quality. Number 1. Set a regular sleep schedule. Going to bed and waking up at the same time each day, even on weekends, can regulate the body's internal clock and improve overall sleep quality. Number 2. Create a calming pre-sleep routine. Engage in relaxing activities like reading, meditating, or stretching to unwind an hour before bed. Avoid activities that are too stimulating or stressful, as these can make it harder to fall asleep. Number 3. Limit screen time. Blue light from screens can disrupt melatonin production, making it harder to fall asleep. Putting devices away at least an hour before bed helps promote better sleep. Number 4. Optimize your sleep environment. A dark, quiet, and cool room encourages better rest. Investing in a comfortable mattress and pillows can significantly improve sleep quality. Number 5. Mind your diet. Consuming caffeine or alcohol close to bedtime can interfere with sleep quality. Try to limit these and avoid heavy meals before bed. Here are 5 essential points you must know about the power of sleep and its impact on mental health. Number 1. Sleep's impact on emotional stability. Poor sleep disrupts the brain's emotional regulation, leading to increased sensitivity and reactivity. This heightened reactivity can make even small issues feel overwhelming, leading to frequent mood swings and emotional outbursts. In contrast, a good night's sleep strengthens emotional stability, helping you face challenges calmly and respond with more patience and control. Number 2. Sleep and cognitive clarity. Sleep is essential for mental clarity and focus, particularly during non-REM stages when the brain clears out metabolic waste. Without enough rest, brain fog, forgetfulness, and trouble concentrating become more common. Over time, this cognitive decline can affect productivity and leave you feeling mentally exhausted, impacting work and daily tasks. Number 3. Mental health conditions and sleep. Sleep is especially crucial for managing mental health conditions like anxiety, depression, and PTSD. Poor sleep can worsen symptoms, making emotional regulation and stress management even harder. Consistent sleep supports a calmer mind by reducing cortisol, the stress hormone, and allowing the brain to handle these conditions more effectively throughout the day. Number 4. The importance of a sleep routine. Regular sleep patterns align with our body's natural circadian rhythm, improving both sleep quality and mental stability. Inconsistent schedules confuse our internal clock, leading to irregular sleep and impacting mental health. Establishing a routine helps promote uninterrupted sleep, creating a foundation for improved emotional regulation and mental resilience against stress. Number 5. The role of sleep in reducing stress and building resilience. Sleep provides a natural reset for the brain, lowering stress levels by reducing cortisol production. Those who get enough rest are better equipped to manage daily stress, adapt to changes, and bounce back from adversity. Quality sleep strengthens resilience, empowering the mind to stay balanced, focused, and prepared for life's challenges. Let's understand some common myths and facts about sleep and mental health. Myth number 1. I can function well on just a few hours of sleep. Fact. Most adults need 7 to 9 hours of sleep to function at their best. Chronic lack of sleep can negatively impact mood, memory, and focus. Myth number 2. Only people with mental health issues struggle with sleep. Fact. Sleep disturbances can affect anyone due to stress or lifestyle factors. However, those with mental health conditions may experience them more frequently. Myth number 3. Naps can replace lost nighttime sleep. Fact. While naps may help with fatigue, they don't replace the benefits of full, uninterrupted sleep. Deep sleep is essential for brain recovery and emotional stability. Myth number 4. Alcohol helps you sleep better. Fact. Although alcohol might make you feel drowsy, it disrupts sleep cycles and prevents deep, restorative sleep, which is crucial for mental health. Myth number 5. If you lie awake, just stay in bed until you fall asleep. Fact. It's actually better to get up and do something calming. This helps prevent frustration and retrains your brain to associate bed with rest, not sleeplessness. Here are 5 common symptoms. Mood swings, difficulty concentrating, increased anxiety, low energy and fatigue, weakened immune system. 5 essential self-care pointers. Prioritize restful sleep. Stay physically active. Practice mindfulness and meditation. Nourish your body with healthy foods. Set boundaries and take breaks. Let's understand why your mental health is important. Here is 5 key reasons. Number 1. Mental health drives overall well-being. Mental health is a foundation of overall health. When we are mentally well, it's easier to handle life's challenges, build strong relationships, and pursue goals. Mental well-being is tied to our emotional resilience, helping us cope with setbacks and stress. Good mental health allows us to process emotions effectively, stay grounded, and see things from a balanced perspective. When mental health suffers, so does physical health, as stress and unresolved emotions can lead to physical symptoms like fatigue, headaches, and even weakened immunity. Number 2. Mental health affects physical health. The mind and body are deeply connected. Poor mental health can impact physical health, as stress and anxiety trigger hormonal imbalances and inflammation. Over time, untreated mental health issues may lead to chronic conditions like heart disease, diabetes, and weakened immunity. Additionally, poor mental health affects sleep, appetite, and energy levels, creating a cycle where physical health deteriorates, worsening mental health further. Caring for mental health is essential to maintain overall physical wellness and to reduce the risk of long-term health issues. Number 3. Mental health shapes relationships and social connections. Our mental health profoundly affects our ability to connect with others. When mentally well, we communicate effectively, express empathy, and maintain fulfilling relationships. Poor mental health, however, can create emotional distance, make us feel isolated, and reduce social engagement. Depression and anxiety, for instance, often make social interactions feel draining or overwhelming. Investing in mental health enhances emotional connection, which builds a stronger support system and improves social well-being, adding purpose and happiness to life. Number 4. Mental health influences productivity and success. Good mental health is essential for focus, motivation, and creativity, all of which contribute to success at work or school. Mental clarity, resilience, and confidence enable us to set goals, overcome obstacles, and make sound decisions. Poor mental health can impair these abilities, leading to procrastination, reduced productivity, and self-doubt. Mental health support boosts motivation and cognitive function, enhancing our ability to reach personal and professional goals and leading to a greater sense of accomplishment and satisfaction. Number 5. Mental health empowers self-discovery and growth. Mental health shapes our ability to understand ourselves, our values, and our goals. Self-awareness is key to personal growth, and maintaining mental health helps us reflect, make informed choices, and evolve. With a strong mental foundation, we can better identify what truly matters, set healthy boundaries, and nurture personal growth. Prioritizing mental health gives us the tools to address challenges, overcome limiting beliefs, and build a life that aligns with our deepest aspirations, leading to a fulfilling and purposeful life. Before we proceed, here's a quick Q&A. If you think you're smart enough to answer them, drop your responses in the comment section below. Question number 1. Which of the following is a sign of poor mental health? Option number 1. Increased energy levels. Option number 2. Difficulty concentrating. Option number 3. Enhanced social connections. Option number 4. Improved sleep quality. Question number 2. How does sleep affect your emotional well-being? Option number 1. Sleep improves emotional regulation. Option number 2. Sleep makes you more reactive. Option number 3. Sleep causes mood swings. Option number 4. Sleep leads to forgetfulness. Question number 3. What can chronic stress lead to? Option number 1. Improved cognitive function. Option number 2. Increased resilience. Option number 3. Anxiety and depression. Option number 4. Enhanced creativity. Question number 4. Which of the following is not a benefit of good mental health? Option number 1. Better decision-making. Option number 2. Improved relationships. Option number 3. Increased physical illness. Option number 4. Greater productivity. Question number 5. What is one of the primary effects of sleep deprivation on mental health? Option number 1. Improved focus. Option number 2. Increased energy. Option number 3. Heightened emotional sensitivity. Option number 4. Reduced stress levels. The importance of better sleep for mental health and well-being. Sleep is one of the most important yet often neglected aspects of our overall well-being. For many, sleep is seen as a luxury or an afterthought in the busy rush of modern life. However, research continues to emphasize the vital role that sleep plays in maintaining mental, emotional, and physical health. Better sleep is not just about getting more hours of rest, it's about improving the quality of that rest, understanding sleep patterns, and creating an environment that promotes healthy, restorative sleep. Poor sleep can have wide-reaching consequences, impacting everything from mood regulation and cognitive performance to immune function and long-term health outcomes. To begin, it is important to understand the science behind sleep. Sleep is a complex, multi-stage process that involves several physiological and neurological functions. Each night, our bodies cycle through different stages of sleep, including REM, rapid eye movement, and non-REM sleep. Non-REM sleep consists of deep stages that are essential for physical restoration, such as tissue repair and immune system strengthening. REM sleep, on the other hand, is the stage where dreaming occurs and is associated with cognitive functions like memory consolidation, learning, and emotional regulation. One of the most significant ways sleep affects our health is through its impact on mental and emotional well-being. Sleep directly influences the brain's ability to process emotions, manage stress, and regulate mood. Sleep deprivation has been linked to heightened emotional reactivity, anxiety, and mood disorders such as depression. When we don't get enough sleep, the brain's amygdala, which processes emotions, becomes overactive, making it harder to regulate emotions in stressful situations. A lack of sleep can also impair the prefrontal cortex, the area of the brain responsible for decision-making, impulse control, and social behavior. This combination of heightened emotional sensitivity and impaired cognitive function creates a perfect storm for mental health challenges, making it more difficult to cope with stress and engage in positive, constructive interactions with others. Improving sleep is a key strategy for managing mental health. A consistent sleep routine, for example, helps to regulate the body's internal clock, known as the circadian rhythm. This rhythm controls our natural sleep-wake cycles, ensuring that we feel sleepy at night and alert during the day. Disruptions to this cycle, such as staying up late or waking up at irregular hours, can confuse the body and lead to difficulty falling asleep, waking up, and staying asleep. Therefore, maintaining a regular sleep schedule is one of the most effective ways to improve the quality of your sleep. Going to bed and waking up at the same time each day helps to train the body to feel sleepy when it's time for rest and stay alert when it's time to rise. Sleep hygiene, or the practices that promote good sleep, plays a crucial role in achieving better rest. Sleep hygiene includes a wide range of factors, from the physical environment where you sleep to your pre-bedtime activities. Creating a sleep-friendly environment is an essential step in improving sleep quality. This involves making sure that your bedroom is cool, quiet, and dark. Studies show that cooler temperatures can help lower body temperature, which signals to the brain that it's time for rest. Darkness is equally important because light exposure, particularly blue light emitted by screens, suppresses the production of melatonin, the hormone that helps regulate sleep. Minimizing exposure to screens and bright lights before bedtime can significantly enhance melatonin production, making it easier to fall asleep. Moreover, comfort is a critical element of sleep hygiene. Investing in a good mattress, comfortable pillows, and soft, breathable bedding ensures that your body is fully supported during rest. An uncomfortable sleep environment can lead to tossing and turning throughout the night, preventing you from entering deeper stages of sleep. Additionally, noise can also disrupt sleep. Using earplugs or a white noise machine can help create a calm atmosphere conducive to sleep. If you live in an area with a lot of noise-cancelling devices or soundproofing your bedroom can also help improve sleep quality. In addition to environmental factors, lifestyle choices have a significant impact on sleep. Regular physical activity is one of the most effective ways to improve sleep quality. Exercise helps to reduce stress, anxiety, and depression, which can all interfere with sleep. It also promotes the release of endorphins, the brain's natural mood elevators, which can lead to a more relaxed state before bed. However, it is important to avoid vigorous exercise too close to bedtime, as it can increase heart rate and core body temperature, making it harder to fall asleep. Diet also plays a crucial role in sleep. Certain foods and beverages can either promote or disrupt sleep. For instance, caffeine and nicotine are stimulants that can stay in the body for several hours, making it harder to fall asleep. It is recommended to avoid these substances, particularly in the late afternoon and evening. Alcohol, although it may initially make you feel drowsy, can disrupt the sleep cycle and prevent you from entering deep, restorative sleep stages. On the other hand, foods rich in tryptophan, magnesium, and melatonin, such as turkey, nuts, seeds, and cherries, can naturally promote better sleep by supporting the body's production of these sleep-regulating chemicals. Another important aspect of better sleep is managing stress and anxiety. Stress and racing thoughts are major barriers to falling asleep and staying asleep. Incorporating relaxation techniques into your evening routine can significantly improve sleep. Deep breathing exercises, progressive muscle relaxation, or guided meditation can help quiet the mind and prepare the body for rest. Mindfulness practices, which involve focusing on the present moment, can also help reduce anxiety and promote relaxation before bed. Journaling is another effective strategy for releasing pent-up stress. Sleep problems, such as insomnia or sleep apnea, can sometimes require medical intervention. Insomnia is characterized by difficulty falling asleep or staying asleep, and it can be caused by stress, anxiety, or poor sleep habits. In some cases, cognitive behavioral therapy, CBT, for insomnia is an effective treatment. Sleep apnea, which involves interruptions in breathing during sleep, can lead to poor sleep quality and fatigue. If you suspect you have sleep apnea, it is important to consult a healthcare professional for diagnosis and treatment. In some cases, using a continuous positive airway pressure (CPAP) machine or other devices can help manage the condition and improve sleep. Overall, better sleep is one of the most effective and accessible ways to improve your mental, physical, and emotional health. By prioritizing sleep, creating a sleep-friendly environment, and adopting healthy habits, you can enhance your quality of life and experience the many benefits of restorative rest. Whether you're looking to improve your mood, boost productivity, or strengthen your immune system, improving your sleep is an essential step toward a healthier and happier life. Remember, sleep is not a luxury, it's a necessity, and investing in better sleep can pay dividends in all aspects of your well-being. What are sleep disorders? Sleep disorders are conditions that affect the quality, timing, or duration of sleep, resulting in difficulty falling asleep, staying asleep, or waking up too early. Sleep is essential for both physical and mental health, yet millions of people around the world struggle with sleep disorders. These disorders can range from short-term issues like stress-induced insomnia to chronic conditions like sleep apnea, which may require medical intervention. Sleep disorders not only lead to sleep deprivation but can also have serious consequences on overall health. They can contribute to mood disturbances, cognitive impairment, weakened immune function, and increased risk of serious diseases like diabetes and heart disease. The most common sleep disorders include insomnia, sleep apnea, restless leg syndrome, narcolepsy, and parasomnias like sleepwalking or night terrors. Understanding the different types of sleep disorders and their causes is crucial for managing them effectively and improving sleep quality. Insomnia, the most common sleep disorder. Insomnia is perhaps the most well-known sleep disorder. It refers to the difficulty falling asleep, staying asleep, or waking up too early and not being able to fall back asleep. While it can be short-term, typically lasting for a few days or weeks due to stress or anxiety, chronic insomnia lasts for at least 3 times per week over a period of 3 months or more. Causes of insomnia include stress, anxiety, depression, poor sleep habits, caffeine consumption, and certain medications. People with insomnia often experience daytime fatigue, irritability, difficulty concentrating, and mood disturbances. Insomnia can also worsen existing health conditions, making it harder to manage chronic illnesses. Treatment for insomnia generally involves cognitive behavioral therapy, CBTI, which helps individuals change behaviors and thought patterns related to sleep, and in some cases, medications may be prescribed as a short-term solution. Sleep apnea, a dangerous disorder. Sleep apnea is a serious sleep disorder where a person's breathing repeatedly stops and starts during sleep. This can lead to interrupted sleep and low oxygen levels, which may cause daytime fatigue, irritability, and difficulty concentrating. The most common form of sleep apnea is obstructive sleep apnea, OSA, which occurs when the muscles in the throat relax excessively during sleep, blocking the airway. Central sleep apnea, a less common form, occurs when the brain fails to signal the muscles to breathe. People with sleep apnea often snore loudly, choke, or gasp for air during the night, disrupting both their sleep and that of anyone nearby. Sleep apnea is a serious condition that can lead to high blood pressure, heart disease, stroke, and diabetes if left untreated. Treatment options for sleep apnea include lifestyle changes like weight loss, continuous positive airway pressure, CPAP, therapy, and in some cases, surgery to remove or reposition tissue obstructing the airway. Restless leg syndrome, RLS, a sleep disruptor. Restless leg syndrome, RLS, is a condition that causes an irresistible urge to move the legs, often accompanied by uncomfortable sensations like itching, crawling, or tingling, usually when lying down or trying to fall asleep. This compulsion to move the legs can lead to significant disruption of sleep, making it difficult to fall asleep and stay asleep. RLS is more common in older adults and can be triggered or worsened by conditions like iron deficiency, kidney failure, or pregnancy. The symptoms of RLS may worsen at night when the person is trying to rest, leading to an ongoing cycle of sleep disturbances and daytime fatigue. Treatment for RLS includes lifestyle changes such as improving sleep hygiene, regular physical activity, and addressing any underlying medical conditions. Medications like dopamine agonists or anticonvulsants may also be prescribed to help alleviate the symptoms of RLS. Narcolepsy, sudden sleep attacks. Narcolepsy is a chronic neurological disorder characterized by excessive daytime sleepiness and sudden, uncontrollable episodes of sleep, often referred to as sleep attacks. These sleep attacks can occur at any time during the day, regardless of activity, and can last from a few minutes to an hour. In addition to excessive sleepiness, narcolepsy may also cause cataplexy, a sudden loss of muscle tone triggered by strong emotions like laughter or excitement, which can lead to falls or other accidents. Narcolepsy is thought to be caused by a deficiency of hypocretin, a brain chemical that regulates wakefulness. The disorder can significantly impair a person's ability to function during the day and affect relationships, work, and overall quality of life. While there is no cure for narcolepsy, treatments like stimulant medications, antidepressants, and lifestyle adjustments can help manage the symptoms and improve sleep quality. Parasomnias, abnormal sleep behaviors. Parasomnias are a group of sleep disorders that involve abnormal behaviors during sleep, such as sleepwalking, night terrors, and REM sleep behavior disorder, RBD. These behaviors can disrupt sleep and cause injury to the individual or others around them. Sleepwalking, for example, involves walking or performing other complex behaviors while still asleep, with no memory of the actions afterward. Night terrors, which are more common in children, are characterized by sudden awakening from deep sleep with screaming, confusion, and rapid heart rate. REM sleep behavior disorder involves acting out vivid dreams during REM sleep, sometimes leading to violent movements that can cause injury. Parasomnias are more common in children but can occur in adults as well, often linked to factors like stress, sleep deprivation, alcohol use, or medications. Treatment for parasomnias involves improving sleep hygiene, managing stress, and in some cases, medications like sedatives or melatonin to regulate sleep cycles. Circadian rhythm disorders, disruptions in the internal clock. Circadian rhythm disorders occur when a person's internal sleep-wake cycle, known as the circadian rhythm, becomes misaligned with external cues like light and darkness. This can result in problems such as insomnia, excessive daytime sleepiness, or difficulty waking up at a desired time. One of the most common circadian rhythm disorders is delayed sleep phase disorder, DSPD, in which individuals have a natural tendency to fall asleep late at night and wake up late in the morning, making it difficult to meet the demands of work or school. Another common disorder is shift work sleep disorder, which affects people who work non-traditional hours, such as night shifts, and experience difficulty adjusting to irregular sleep patterns. Circadian rhythm disorders can have a significant impact on mental health, leading to symptoms of depression, anxiety, and poor cognitive function. Treatments for circadian rhythm disorders include behavioral therapies like cognitive behavioral therapy for insomnia, CBTI, light therapy, and medications that help reset the internal clock.